Assalamu alaikum. Welcome to the fourth video. Welcome to the fifth video where we will be going through some basic steps to provide first aid. Previously, we got to know how important first aid was, as it can help any common person to save a person's life, a victim's life who is suffering from a severe injury in case medical institutes or hospitals are not nearby and there's not a doctor at the point present near the victim. So a person aware of the first aid knowledge can come up and help the victim and save their life. So we got to know how to treat cuts and scrapes. That involved 5 basic steps that were stopping the bleeding, cleaning the wound, applying an antibiotic, covering the wound, changing the dressing, and watching for signs of infection. Then we got to know that even if a person is aware of the first of how to provide first aid, do they cannot practically perform it without a first aid kit, and first aid kit is very important as it should be present in homes and schools so that it can be very useful in case of emergencies. And then we got to know about the contents of first aid. That included a first aid book, band-aids, elastic bandages, and now we're moving on to the fourth thing, that is gauze and adhesive tape. Gauze pads or rolls are cotton pads that are placed directly on a wound to protect and control bleeding. So in case the cut or the injury is larger and we cannot use a band-aid, we should immediately refer to gauze and adhesive tapes, and they are very useful to be present in the first aid box. You will need adhesive tape to keep the gauze in place. So the gauze itself do not have any adhesive material, and hence adhesive tapes comes in that helps it to hold it in place. In an emergency, a clean cloth, hand towel, clean t-shirt can be used to cover the wound. In case the first aid box or kit was not made very professionally and there's no gauze and adhesive tape present, and still the person is continuously bleeding and we need to provide with something that can help stop the bleeding, we can use a clean cloth. So a clean cloth necessarily, so there won't be an infection or a sting or rashes around the wound, a hand towel or a clean t-shirt. So this was the fourth thing that should be present in a first aid kit. Moving on, next is antiseptic wipes or alcohol swabs and cotton wool. So there's no such description given here, but I can tell you what antiseptic wipes are. Antiseptic wipes are wipes that are that are not very dry or not very wet, and they can be used to clean the place around the wound and clean the skin around the wound. And then cotton wool are used for the similar purposes, and alcohol swabs too. Next is the safety pins and tweezers. So in case the bandages or the plasters are not adhesive itself, we can use safety pins and tweezers because they can be used to clean the debris around the wound. Scissors, because if it's a very long gauze pad or it's a very long dressing, we need to use scissors to cut it. Latex gloves. Latex gloves are always a good idea, especially if you are dealing with with body fluids from a stranger. So in case that our hands are not clean, we immediately need to wear latex gloves because we may not know if the person has an infectious disease or so, and they're very helpful as they will help us not catch germs or infections. Calamine lotion. Calamine lotion is used for soothing burns and stings. So in case the person is in very much pain due to the burns of the cut or the injury, calamine lotion can be applied to soothe the wound. Clinical thermometer. So in case a person is having fever, we can detect it or we can measure it through a thermometer. Analgesic tablets such as aspirin or paracetamol, they can also be used. They can also be called as painkillers or pain relievers. Any common types such as paracetamol or aspirin or Panadol that can be given to the patient to reduce their pain. So that's our first aid, some basic instructions regarding the first aid and some basic contents of the first aid kit done.